Research universities across the country are alarmed about possible major funding cuts.
The Trump administration wants to put a cap on how much colleges and nonprofits can get from the National Institutes of Health. As THV 11's Maya Ellison shows us, while the White House targets the Ivy League, smaller programs here in Arkansas could feel the pinch.
But what I can tell you is that if we lose this money, Arkansas as a state loses. We lose.
On Friday, the National Institutes of Health announced it's lowering the, quote, maximum indirect cost rate research institutions can charge the government to 15%, impacting the amount of money organizations can receive for research funding nationwide.
That would mean partners like UAMS, U of A system, and Arkansas Cancer Coalition would lose millions of dollars as it relates to cancer control and other health-related research.
Even universities and other organizations like Arkansas Children's Hospital could feel its effects.
Our babies, a lot of them have blood-borne cancers. It requires the research.
Trina Mitchell with the Arkansas Cancer Coalition says they're almost 100% funded by state and federal grants, receiving about $300,000 from the NIH. With those cuts, she says they could face a damaging loss that would be felt for years.
This was a multi-million-dollar grant over a 10-year span. So you're looking at maybe losing out upwards of $5–6 million.
Organizations like UAMS receive about 70 to 80% of NIH funding, even recently receiving a $2.9 million grant to study a virus that can trigger cancers. In a statement from Vice Chancellor Leslie Taylor, she says the effects of a 15% cut would, quote, result in an annualized loss of more than $10 million.
For one, it means that this project will no longer be in existence. We cannot move forward with making sure the residents of St. Francis County have access to cancer screenings. And it also means that we will have to rework our budgets and scale down what we offer to our residents here in Arkansas.
And Mitchell says the cuts can hurt much more than organizations.
It's going to affect how doctors talk to their patients about what's needed for their health care.
In Little Rock, Maya Ellison, THV 11 News.
Maya, thank you. And like many of the White House executive orders so far, these funding cuts are now on hold. A federal judge in Massachusetts put a temporary hold on the plans earlier today.